Hello, my name's Emily Baird. Thank you for watching my presentation on human immunity. So, what is immunity? It's essentially our protection against disease and infection that could cause us harm. Disease and infection can be transmitted through direct transmission, like coughing, and someone coughs near you and you inhale the droplets that they cough. Indirect transmission, this could be touching a door handle that someone has previously touched and they've got an infection and then you wipe your mouth. Insect bites, for example, malaria is transmitted through this. And food contamination, like eating uncooked meats or food that hasn't been handled properly, someone hasn't washed their hands. The first line of defence. Now, this is an important part of the immune system. The body has several lines of defence. The first line of defence is non-specific, so it responds exactly the same way, no matter what the pathogen is that's entering the body. There are physical and chemical barriers that prevent the entry of pathogens. And the response, as I said, will always be the same, no matter what the pathogen will be. If we look at the skin as a first line of defence, this is the most effective barrier against pathogens. It's the largest organ on the body, and as long as it remains unbroken, so there's no cuts, it's very effective at stopping pathogens entering. There's 3 layers of the skin. The outermost layer is the epidermis. Now, this is what we can see and touch, and this forms a barrier against pathogens and also protects against fluid loss within inside the body. The dermis, this is the inner layer. It's like a thick elastic layer, and this helps to store energy and fat as well. The inner layer, the subcutaneous, also known as the hypodermis, this helps to store energy, and it's a fatty layer that consists of blood cells and collagen fibres. If we look at the tears, now this is a mucous membrane. This is the first line of defence as well in the body. Now, your tears actually contain a chemical called lysozyme that help to kill bacteria. So not only do your tears wash away dirt and debris and dust from the day, or if you get something in your eye, you'll naturally start to produce tears, but it also helps to kill the bacteria that's entering the eye. So it's a very effective first line of defence. Now, second line of defence. When an infection or bacteria enters the body, a response is then triggered and your body tries to kill that bacteria. If you look at figure 5, you can see here a nail or a needle that's dirty has entered the skin. Here what happens is blood flow is increased. The body has been alerted that there is bacteria, that there's a foreign invader. Inflammation then begins to happen, and the cell walls create little gaps allowing the immune response blood cells to pass. This increase in blood flow causes an increase in strength of the immune system response in the localized area. As white blood cells and other cells begin to surge on the infected area, increasing the immune response, there will be an increase in body heat. This is completely normal for your cuts and wounds to feel hot. That's as the body is trying to heal it. It actually has an antibiotic effect. A macrophage, this is a type of white blood cell, which is a phagocyte. And a phagocyte makes up a large percentage of the white blood cells in the body. They work by ingesting and destroying pathogens, eating them up essentially, having an enzyme that surrounds them and then starts to destroy them. The word macrophage literally means big eater, so they just go around eating up all the dead cells in the body. If we look at the third line of defence, pathogens and antigens. So a pathogen is essentially an infectious microbe. This could be anything that's too small to be seen by the naked eye. It could be a virus, fungi, parasite, bacteria, anything like that. An antigen is actually a part of the pathogen that signals your body is being attacked, and these trigger the immune response that we know of. Different types of immune cells. Now there's 5 different types of white blood cells. These are also known as leukocytes. A neutrophil, this is the most common type of white blood cell. These work by attaching to the walls of the blood vessels, which has an effect of blocking the germ's entry into the bloodstream through a cut. They're the first cells to reach any infected area of the body, and they act by means of a process known as phagocytosis or the cell eating, which we discussed earlier. Then we have lymphocytes. These are small cells. They play a major role in the immune system. They're usually found in lymphatic tissues like the spleen and tonsils and lymph nodes. They make antibodies, which is one of the last steps in disease resistance. When they make antibodies, they make memory cells that remember the previous infection by a specific pathogen. So they actually remember the infection, so they know what to do next time. Monocytes, these are the largest of the white blood cells. They're less common, but they turn into macrophages when they exit the bloodstream. As macrophages, monocytes do the job of phagocytosis, so they eat up the dead cells in the body. Because they're quite large, this gives them the ability to clean up wounds quite well. Eosinophils, These are quite rare. They're important when it comes to allergies and worm infestations. They work by releasing toxins to kill pathogens, which are mainly parasites and worms. A high count of this type of white blood cell is associated with allergic reactions. Basophils, these are the rarest type of white blood cells, and they secrete anticoagulants and antibodies that act against hypersensitivity reactions. They act instantly as part of the immune system's action against foreign invaders, and they help to dilate the blood vessels, allowing more immune cells to reach an infection more quickly. Immunoglobulins. Now, these are also known as antibodies. They help to target infection and decide which immune cells are needed at the time. Your bone marrow will make these immunoglobulins, and there are several types. IgG, this is a molecule that can promote very direct attack on anything that recognises as being foreign. It's the only type of immunoglobulin that is transferred across the placenta from the mother to the fetus. So this provides unborn children with some protection from diseases that they haven't encountered yet. IgA, this plays an important role in the cellular defence of soft, moist mucosal surfaces on the body, like inside the mouth and the nose. A lack of IgA often does cause infections of the mucosal surfaces like the mouth, throat and lungs. IgM, now this is a immunoglobulin that is comprised of 5 normal immunoglobulins. They're joined at their bases, and it's the first immunoglobulin made in any antibody response. IgE, this is the biggest immunoglobulin. High levels of this increase drastically as a response to parasitic infections and allergic reactions. And hay fever is a common condition caused by too much IgE. IgD, now this is an uncommon molecule. We don't really know what the cause of this is, what the true function is at the moment. Okay, recognising self and non-self. Now, the immune system is very good at recognising itself and a foreign invader through the work of antigens. It can distinguish when something else is attacking it. It does this by the major histocompatibility complex, which is MHC1 and MHC2, along with human leukocyte antigen gene complex. Now, MHC is a tightly linked cluster of genes present in every human. MHC1 molecules, these act as an early warning system to the immune system. If a cell contains pathogens, it will destroy the proteins into pieces and display these fragments of the MHC1 on the surface of the cell to present and permit them to be recognised by foreign invaders. MHC2 molecules, these have a similar role, but are only found in certain cells of the immune system. These act as extracellular presentation mechanism, the same as an MHC1, but they present antigen from the extracellular pathogens like bacteria. What is failure of self-tolerance? So this is when the body doesn't recognise itself. It's called hypersensitivity. This can lead to autoimmune diseases, which can lead to illness and also death in some cases. There are 4 types of hypersensitivity responses, and they react differently depending on the antigens that are the body's response. Type 1 hypersensitivity, this causes an immediate response, and this happens after a person has exposure to an antigen. With this type of reaction, the body responds to an antigen by producing the antibody IgE. Examples of this would be reaction to food, animal fur, dust, things like that. Type 2, this causes a cytotoxic reaction, and this means that healthy cells actually begin to die as they respond to the antigens. It can cause long-term damage to cells and tissues, resulting in conditions like thrombocytopenia and Graves' disease. And this responds with the antibodies IgG and IgM. Type 3, this hypersensitivity is when antigens and antibodies form immune complexes in the skin, blood vessels, joints, and the kidney tissues. These complexes cause reactions that lead to tissue damage, and this can be reactions from some medications, insect bites, and reactions like this can lead to lupus and rheumatoid arthritis. Type 4 hypersensitivity, this causes a delayed reaction. Instead of the antibodies controlling the reaction, this is controlled by white blood cells known as T cells. Examples of this would be contact dermatitis from poison ivy or metals, certain drugs. What is a rejection of a transplanted organ? Now, an organ transplant is essentially when tissue or an organ is transplanted from one place to another. It's very important that the immune system knows to accept the organ and not reject it. The body's natural reaction is to reject it, so it's very important that we know how to give the right medication and what to do to stop that. When a transplant's been done, obviously the body recognises it's foreign, so it tries to attack it. Organs that aren't closely matched to the recipient, this can cause blood fusion rejection and also transplant rejection. The likelihood of rejection can be greatly reduced by closely matching the donors and the recipient, and this is called tissue typing. This is very important in organ donation. Monoclonal antibodies can be used during and after surgery to stop the specific T cells which cause rejection of the organ. If these medicines aren't used, then the body will always launch an attack on the transplanted organ. There are 3 types of rejection. There's hyperacute. Now this happens within minutes after the transplant, and this is a result of unmatched organs, unmatched antigens, and the tissue should be removed straight away so the patient doesn't die. Acute reaction, this can happen anytime from the first week up to 3 months after the transplant. Most patients will have some amount of acute rejection. And then chronic, this happens over the course of many years as the body starts to slowly damage the transplanted tissue because it recognises it as foreign. Now, autoimmune diseases, usually the body's immune system is very good at fighting, but sometimes it begins to attack healthy cells within the body. It starts to attack itself. We don't really know why it does this. There's lots of theories, but it's not really completely understood. Some autoimmune diseases can affect more men than women and vice versa. Again, we don't really know why. Some theories suggest that bacteria, viruses, genetics, environmental factors all play a role among other things. So if we look at specific immune system disorders, we look at multiple sclerosis. This is a disease that attacks the myelin sheath, which is the coating around the nerves. This affects the brain and the spinal cord. As these lesions begin to appear, it causes the little break in the myelin sheath and it causes those lesions. It can have a range of symptoms from blurred vision, which causes optic neuritis, balance and mobility problems, and muscle weakness. Usually begins to affect people in their 20s and 30s. Diagnosis doesn't come until later. It's very difficult to diagnose MS. It's more common in women than men. Again, we don't really know why. There currently is no cure for multiple sclerosis, but there are disease-modifying therapies that help to reduce relapse rates and the severity. There's 3 types of multiple sclerosis. There's relapsing remitting, where people will generally have a period of relapse where their symptoms will be worse, and then a time of remission where their symptoms will generally be a little bit better. Primary progressive, this is very severe. This is when you, from your moment of diagnosis, you will just progressively get worse and your disability will get worse over time. And then secondary progressive, most people get this after having relapsing remitting MS for 10-20 years, and they will start to progressively get a bit more worse since then. Another autoimmune condition is psoriasis. This affects the skin. T cells act as though they're fighting an infection, and this causes them to produce inflammatory chemicals. The chemicals that it produces, it causes rapid skin growth that creates plaques of itchy, raised skin, which is very common to see within psoriasis patients. It can occur at any age, and it's equal among men and women as well. Treatments for this can include, again, like medications, creams, ointments to try and help reduce inflammation and help with pain, itchiness, things like that. Again, there is no cure for psoriasis, so it's just a case of management and treating and helping people to cope the best with it as they can. Now, acquired immunity. Now, acquired immunity is a learnt response from the body's immune system. This works out as the most effective way at attacking invading antigens. It's not something that you're born with. This is acquired, as the name suggests, over time and over exposure to various pathogens. It's often called specific immunity because the body's immune system remembers that an antigen it's previously encountered and then knows how to deal with it. A good example of this is the way a baby receives antibodies through a mother's breast milk. It's been proven that this is very effective. So that would be an acquired way, a passive acquired way of receiving antibodies. Artificial immunity, this can be acquired through vaccination. Now, this is when the body will be exposed to an antigen on purpose through a vaccination, so the body will know how to deal with it if it encounters it in the future. We know this is very effective, and that's known as active artificial immunity. It can also be achieved through introducing antibodies into the body to create a protective immune activity. This is known as passive artificial immunity. Now, immune response to vaccination. Vaccination requires injecting, as we know, a weakened pathogen into the body to stimulate the white blood cells to produce antibodies against that pathogen. Immunological memory is the immune system's ability to remember that pathogen and to respond to it when it's been previously encountered, and it knows how to respond to it quicker and more effectively than it did before. This is the reason that vaccinations are carried out today, because we know they're effective. When a pathogen is introduced into the body for the first time, it takes a little while for the antigen to be identified and for the B cells for the correct antibody to be produced. During this time, the infection takes hold and symptoms will start to occur. Memory cells are then produced, which can recognise the pathogen if it returns. And if the pathogen comes back, even decades later, the immune system remembers that pathogen and knows exactly how to fight off. It knows which antibodies to use. If we look at measles rates and vaccinations from 1940, measles is caused by the morbillivirus or the paramyxovirus. Early symptoms include the onset of fever, malaise, head cold, conjunctivitis, red eyes, cough, things like that. Now, the most common complications of measles include pneumonia, ear infection, diarrhea, convulsions. Rarely it can cause encephalitis and death. Measles is definitely preventable by vaccination. So children will usually receive 2 doses of the measles, mumps, rubella, the MMR vaccine, as part of their childhood vaccinations. Now, the first vaccine for measles was given in 1968. Rates during this time, between 1958 to 1967, were 4 million, and 863 deaths were actually reported during that time. In the 10-year period from 1968 to 1977, so this was the 10-year period after the first vaccination, there were only 293 deaths and 1.5 million cases. So this drop in measles cases saved over 500 lives, and in 10 years prevented millions of people from becoming ill. So we know that the measles vaccination is very effective. In the year 2020, there were 79 confirmed cases of measles in the UK. So it is still about, it's not eradicated completely like we have eradicated smallpox through vaccination, but it is still very effective against transmitting and getting poorly from measles. Now, herd immunity. When a high percentage of the population is vaccinated against a contagious disease, there are fewer people within that population that can become infected. If someone has mumps, for example, and they're in close contact with other people that have been vaccinated against mumps, the disease can't really easily be passed on to them, and this is known as herd immunity, ensuring a large percentage of the population is vaccinated against a contagious disease. Smallpox, as I said earlier, was the first disease to be eradicated by vaccination. Rates of the population being vaccinated to reach herd immunity does vary depending on the disease, but the concept will remain the same, to have a high proportionated of vaccinated people to protect the vulnerable. We know that diseases spread easily. We can pass hundreds of people throughout a day, so reaching herd immunity is very important to keep vulnerable people safe. Vaccination programs do take years to produce. There's got to be studies and testing to make sure that they're safe and effective, and the population obviously needs to be made aware of what's in the vaccine and whether it's safe and why they need to take it. Now, factors affecting vaccine uptake. Now, vaccination has always been a very personal choice. Apart from the COVID vaccine, where some people have been, they have to take it for their job. Parents can make informed decisions about whether they wish to have their children vaccinated or not. And there are many factors that affect this, one of them being fear of developing autism from the MMR vaccine. Now, this was has been a theory since an article was published in The Lancet in 1998, suggesting that the MMR vaccine does cause autism in children. This has since been discredited, but it obviously is still a worry for many parents today. And there are groups of people that believe vaccines cause more harm than good, and these people would generally be termed as anti-vaxxers, and they would prefer not to have vaccines. They prefer using natural methods, things like that. And obviously now that we live in a world with social media and the ability to spread word very quickly, it can easily be spread that something is not safe, and then that gets passed on. It's clear to see that misinformation can stop people from choosing to have vaccinations, so everybody should make their own informed choice through doing research. Thank you for watching my presentation. I hope you enjoyed.